Datuk, Lembah Pantai has consistently been #1 highest case.
Yeah. So when we look in Kuala Lumpur, it's a bit different from you when you look into Rembau ataupun you look into other Simpang Renggam or even Sungai Lui because of the density of the population. So what we are trying to do is to work with the IT, police and etc. to look into how can we zoom down into one area. For example, Masjid India, that area. So we know the block there's actually increased cases there. For example, today in Masjid India, there is a Menara City One. Jumlah disaring in that condominium itself is 1,893 dan jumlah kes positif 24 kes. So then we are looking at focused approach rather than the whole Petaling, for example. So we try to look into the hotspot area, really hotspot area, and it can be located maybe in one small area, like a condominium or even a market, etc.
Would there be enhanced MCO in any of these areas?
So enhanced MCO, it is only to help the Ministry of Health to active case detection, for us to go down to the field to do active case detection. That's where the police and all that to enhance us. But we are now looking into the possibility of empowering our community, mainly, for example, if there's a jawatan kuasa looking after them and the condominium, make sure they have been empowered to safeguard their area. Likewise, as I mentioned much earlier, orang asli as well as the longhouses, they already implemented this in terms of make sure that the high-risk group is not being allowed to come to their community. So if you can do that, that means you're protecting your green area. So your green area, this is important for us. So to look at the cases that have been detected in the green area. So I hope that this is another empowerment, community empowerment. You take care of your home, you take care of your community. If that's the case, then probably we can review back how we can implement this MCO. But more importantly, MCO is to help us to reduce the cases. This is why we need to work with other ministries. Never seen before in history that we implement Act 342 as well as working together very closely, private sector, public sector, and as well as inter-ministry. So every day we have a meeting, inter-ministry meeting, to see how best each ministry can complement with one goal, that is to reduce the infection in the community.